features designed. Oh, there's the subscapularis. Oh, we're losing it. Rotator cuff here. Supraspinatus. So I'm up at the upper left if you're not sure. That little muscle marked in blue, I like that name because supra means above. Spinatus, spine of the scapula. Right? On the left side, you'll see the whole scapula. So think about this muscle. What's its action? Well, you don't have to guess because all you have to do is think about when that muscle shortens, because here's the fibers in this direction. When that muscle shortens, then it's going to pull the arm, and that's called abduction way. And there's a little rotation as well. Here's the infra. Infra means below. Infraspinatus. So if you look, here's the scapula on the left side. There's the spine. So infraspinatus right in there. And there's the, looking at the attachment sites. Insertion here. And when this muscle shortens, we're going to have a similar action here. It's going to abduct. Yes, okay. Teres minor. Okay, there's a teres. Dang it. There's a teres minor and a teres major, and we're going to talk about those. Okay, so the neat thing about this region I'm talking about, I think, is the pressure. Many of the features in this part of the body cavity are involved in internal pressure, which is kind of bizarre. You don't have that in the legs and arms and the head. Yeah. Okay. Diaphragm, major muscle that controls breathing and separates the thoracic and abdominal cavities. So here's the central tendon of the diaphragm. And here's some of the openings, like the caval opening for the inferior vena cava, esophageal hiatus for esophagus, and the aortic hiatus, of course, for the aorta and the azygous vein. Here's a picture I was thinking about. We have these intercostal muscles, and they're important because I mentioned that this intra-abdominal pressure is important, and we need it for defecation, urination, childbirth, and even heavy lifting. We need this internal pressure. But we also need to have stability and strength. So the intercostal muscles, there's 3 sheets of these things. And so that's a testimony to the importance of this unit moving up and down when we exhale and inhale. So you have the external, you have the internal, and the innermost, 3 layers. The external, of course, is superficial, meaning they're on the surface. Pelvic floor. The muscles of the pelvic floor are often ignored, and many people it's weak, and that's why I have this diagram about the Kegels. Kegels will help reduce the likelihood of urinary stress incontinence, especially with women after childbirth. They're going to get a little bit of leakage of urine if their pelvic floor is traumatized. We do these Kegels in sets of 3, right? Hold it for 3, relax for 3. Hold it for 3, relax for 3. It helps if you put on some music because this is tedious. Of course, men, they benefit as well, and that's why I added this diagram to the right. All right, the names seem kind of long, but let's look at these coccygeus. Okay, so that helps you to know that this is in the pelvic floor. So you have the pubo. Think of the pubic symphysis, so it's close to the pubic symphysis. There's the iliococcygeus, which is near the ilium of the pelvis, and the coccygeus near the coccyx. The coccyx is the tailbone here. Okay. Piriformis, I know it doesn't have that coccy name, but it's a muscle that also is involved in other actions, not just the pelvic floor. Sometimes causes problems with the sciatic nerve. We're on the pectoral girdle. And we're on the anterior, so we're looking at the front side. Subclavius helps stabilize it. If you look, it's a good name. Sub meaning under, clavius under the clavicle. Pectoralis minor, deep to the pectoralis major, which we're not seeing in this view. And it's an antagonist for the rhomboids, which are in the back. We'll talk about this soon. Serratus anterior. If you look at this boxer, this is where the development of the serratus anterior is here. And that's when you know a boxer is really a boxer. Like we see these movies in Hollywood, guys throwing punches, and they're so sloppy, it's embarrassing. A real fighter will use the serratus anterior right at the end of the punch. There's only about 3 or 4 inches left, and that's when the snap and the serratus boxer muscle kicks in. Then you know you're in trouble. If you're facing someone like that, it's time to run. All right, posterior thoracic. So now we're looking at the back. I talked about rhomboids just a little while ago. We have a minor and a major, which is larger. Trapezius, the most superficial. Superficial means it's on the surface, so it's covering the teres major, teres minor, and a bunch of other muscles. And its origin on the occipital, the nuptial line back here on the skull, and then cervical 7 through thoracic 12. So here's all the origin. It's a huge muscle, and it's going to insert on the clavicle, which you can see the clavicle on the right side, and the spine of the scapula. We're familiar with that one, and the acromion, which is up here on the scapula. Levator scapulae is different than a lot of these muscles because a lot of these muscles are going to rotate and elevate. And here, well, actually, there's muscles in the trapezius that are going to depress it a little bit. But anyway, here the levator scapulae is just going to bring it a nice up and down direction. I mentioned the rhomboids, minor, smaller, major, and their action is to adduct and rotate. It's a unique action. That's why I have John Henry here, because it's like driving a railroad tie with a sledgehammer. If you know the story of John Henry, he took on the steam hammer, but he died doing it. They carried John, let's see. They carried John Henry to the mountain, up on the mountain so high, and the last words I heard that boy say, give me a cool drink of water before I die. John Henry. Okay, on to pectoral, girdle muscles, the axial. Okay, axial means central. And so we have two that we're looking at. We have the pectoralis major, which is a large muscle that, look at the, here it is, originating from the clavicle, sternum, and ribs. And it's going to insert on the humerus. So a lot of that, and there's a tuberosity here, that roughened area where the muscles attach. Latissimus dorsi, far right, sometimes called the swimmer's muscle because its action is to extend, adduct, and medially rotate. And here's Michael Phelps, Olympic champion, showing good engagement of latissimus dorsi. The scapular muscles, they originate on the scapula, and we think of the deltoid. It's a deltoid-shaped muscle. It's going to medially, abduct, flex, and medially rotate. Okay, so it's going to, wish this guy could move, medially rotate. So it's sort of turning inwards and pulling away from the side of the body. A common site for intramuscular injections, of course. Rotator musculotendinous cuff muscles. Let's look at these. I think I added no. I like to put the teres major in here, but typically you don't. See, I put the teres major. Okay, we mentioned these at the beginning video: supraspinatus, infraspinatus, teres minor. And on the front view, and this is the only anterior attaching muscle of the rotator cuff, is the scapularis. Unfortunately, this is not a perfect joint, and we get these rotator cuff injuries. Circumduction, so moving your arms in circles, but you don't have to do that all the time. You could be a painter, or someone who does this, even a dancer. If you do repetitive actions, eventually the supraspinatus, and do you remember that supraspinatus? Here it is. Supra means above, and it's above the spine of the scapula to the right. Supraspinatus is going to become inflamed and tear because the head is between the acromion, take a look to the right, and the head of the humerus. And so it gets pinched and compressed and torn in there. So that's one. Now I'm telling you, other muscles like subscapularis can be injured as well. Inflammation here, and teres major, teres minor. But it seems to be the supraspinatus is the one that also is going to have impingement. Impingement is when that muscle or the tendon becomes inflamed. It's going to degenerate, and in some ways, and sometimes it tears away from the bone, and a surgeon has to reattach it, suture it here. May remove a painful bursa here. Let's see, here's a bursa right there. And the reason for doing that is that we need space for that infraspinatus to slide through. And so we can trim a little bone, remove that bursa, and give it room to slide so that we don't have future injury. Right, thanks for listening.